This video is about COVID-19 in the Democratic Republic of the Congo. In order to get through the COVID-19 pandemic, we must vaccinate as many people globally as possible. Many low-income countries face unique barriers in the effort to vaccinate their populations. The Democratic Republic of the Congo, or DRC, has one of the lowest vaccination rates in the world. Currently, only about 0.1% of the population has been fully vaccinated. The DRC is one of the biggest, least immunized countries in sub-Saharan Africa. So why is vaccination so low? The DRC faces geographic barriers, healthcare barriers, and cultural barriers. The DRC is the largest country in sub-Saharan Africa and is home to the second largest rainforest in the world. These factors, combined with mountainous regions and vast rivers prone to seasonal flooding, pose geographical challenges when trying to vaccinate the largely rural population. In fact, the country currently has a stockpile of more than 1 million doses of different vaccines, but faces the task of distributing them across a large area where roads and the electricity supply are notoriously poor. The lack of accessible healthcare has been a long-standing issue in the DRC. Many people have to travel long distances before reaching any sort of healthcare facility. There's also very little government funding for healthcare, and the vast majority of health services must be paid for out of pocket. Additionally, there's a significant physician shortage, and the leading causes of death in this area are largely from infectious diseases, which is a problem that has been magnified by the COVID-19 pandemic. Finally, cultural attitudes such as vaccine hesitancy are another major contributor to this issue. Misconceptions surrounding COVID-19 and vaccines abound around the globe, and the DRC is no exception. Many people in this area consider COVID-19 a white man's disease and feel that other infectious diseases such as Ebola, malaria, yellow fever, and cholera are much more imminent threats. In early March 2021, vaccination was shortly halted after fears of serious blood clotting were reported. Fear spread quickly throughout the DRC as rumors were spread that Africans were being used as guinea pigs. Increasing vaccination rates in the DRC is a complicated issue that will require a multi-pronged approach. Areas for intervention must also take a culturally humble approach and take cultural differences and attitudes into consideration. Only through building trust and working with community leaders in a culturally appropriate way will efforts be successful. Increasing vaccination in the DRC and other countries is not only crucial for the health of their citizens, but also the global community to help prevent the emergence of new variants.
Created using Powtoon.